Hi everybody, my name is Rhys Barber. I'm one of the audiologists here at Audiology Associates.
And my name is Taylor Green, or also known as the lovely Mr. Taylor Green.
Lovely Mr. Taylor Green.
I don't call myself that.
He does all the time. Don't believe a word he says. He calls himself the amazing Mr. Taylor Green. It's constant.
Got it in my dressing room.
It's on the back of his scrubs. It's in like silver diamantes on the back of his scrubs. Rhinestones, not diamantes.
Right, yeah, sorry.
Anyway, sorry guys, we digress. We haven't even started the video yet. We've got
yeah.
a cup of tea. This is all me on this one, guys. It's one patient. Oh my word, this was a tough old keratin plug to get out. This was an absolute beastie. We've got keratin, we've got wax, and we've got hair all mixed in there at the same time. Deep as well. And we've got this quite dense, thicker hair, as you can see in there, right at the entrance to the canal, which does impede the view slightly, and it accounts for why there's so much hair debris inside the canals, while patient tends to trim their hairs quite a bit. It's in layers, this plug. It's really difficult. You can see I'm pulling from the side, and normally that would pull the whole plug. You can see that thicker, that really thick underlayer, and that classic mottled red-white sort of, red-white, that'll make pink, kind of look to this ear canal as well, just where all these little lifts of skin have all accumulated into this big, thick old plug here. I know.
That's a beastie. You're lucky you can see the wax, to be honest, on the skin and the keratin.
Yeah, definitely. So we've got the rose, no, that's not a rose insert, it's a Rycroft. So we're going in here with a Rycroft, just pulling from the sides. There we are, just trying to get this top. There we go. You can see it just starting to kind of, I was hoping it would peel the whole plug and the whole thing would come forward, but it just kind of separated those layers. This, there's a name for this in bakery, isn't it? I keep forgetting the name of this. Lamination. It's where they kind of, you've got these layers that have just kind of squished together, and then when you get in the Rycroft in there, it's just peeling those layers apart. Yeah.
It's a thick old piece, isn't it?
It's tough as well. It's really hardened up, and you find with this, you try and get behind it, but that's all it does. It compresses it down. You just slide over the surface of it. I think I'm hesitant about putting the oil in because of these really thick hairs on the outer section of the canal. I know as soon as I put oil in there, it's just going to coat those hairs, and it's going to really kind of make the visualization there a lot more difficult.
It's not doing anything, is it?
It's not budging. Suction's literally just going, nah, it's not going anywhere.
It's like stroking the top.
Yeah, you stay in there, it's fine. So just try to take these extra little layers off the top. I'm trying to find anything I can work with. I'm also conscious that, you know, it is a bit deeper in the, like I'm trying, even the Rycroft is just like, no, I'm really struggling to penetrate into that.
It's awkward in there because you can't really kind of go behind it because it's way too deep.
It is. Let's see if I can detach. If I can get this top layer down, I might just get a bit of a peel, a little bit of a roll going. But it's in such an awkward angle to get to the top. And here we are. I see a little bit of a lift at the bottom. So I'm thinking, oh yeah, this might work. Oh, something broke away.
Yeah.
Let's have a look, see if we can lift that bottom section again. So it all lifts across the bottom, going across the, I'm hoping we're going to get this lift will carry on around the right-hand side of this plug as well. But it's just shearing away. Just those layers are just crumbly enough, it's just breaking away. You are lifting again.
Ooh, it looks like it's about to
it looks like it's going to do something, doesn't it?
Was this all one side, or is it the...
I think, I'm not sure. I can't quite remember. I'm trying to get a grip on this outside edge here.
Yeah. It's that awkward consistency, isn't it? It's like it's too dry for suction, but then it just breaks apart as soon as you use any curettage.
You've got it. Just trying to see if I can just peel... I've gone back to the same spot again just to try and peel this bottom section. And, you know, there's going to be a lot of keyboard warriors in the comment section saying, oh, yeah, just get in there with a tool, just scrape it out. Why are you taking so long? It takes so long because if you don't take so long and you're digging around in there, especially with this type of thing, you're going to cause the patient some pretty serious pain, which is not very pleasant. And we really, really don't want that. We want the patient to have a nice experience and to come back again. So we don't really want to be digging around too much in here if we can help it. Oh, there we go. Do you see that detachment through that little hole then?
Yep. We're getting there.
Yeah, it's starting to peel. It's almost, there you go.
It's like stretchy in a way.
It is. It's almost like there's all that sort of thinner white skin around the outside edge. It's almost like that is just holding on to this. And I've gone back to that top section again to see if I can pull this down. I know, ideally, you know, you'd need just a little, if I can just get a little bit more space up there, I might be able to get something like the Rycroft or maybe the Ryhook in there just to give it a bit of a helping hand down. It's almost like you want to just get the top and just peel it away.
So if you've got the right angle, you could probably just get that hook in just nip behind it.
Yep. I don't know if we get the angle with the Rosen inserts here. I think it's just it's not quite the, you know, I bow to your better judgment the Rosen inserter because you are the king of the Rosen inserter. but I don't think you would have got, because it's just the length on the hook part.
It's too long, isn't it? Yeah.
See, it is just welded in there, and this, you know, doesn't. People say, well, you know, how do they not know they've got this in there? Or, you know, 9 times out of 10 they do know. It's you know, because they've been feeling blocked up.
Yeah.
But skin issues like this, they occur really, really quickly. So sometimes patients will say, you know, I think my ears cleaned out 6 months ago. It can't be that bad, and it will be, you know,
like this.
It'll be horrendous. It'll be really, really jammed in there. But just they don't expect it to build up as quickly as it does. And I would say the average for more skin issue patients, I would say, is probably a 6-month visit, if not sooner for a lot of them.
Oh, it's the infections which catch you by not catch you by surprise, but there's one that sticks in my head that I saw in Cardiff. Completely, I could see there was a lot of. Like, it was a fungal infection, it was, and there was a lot of spores, there was a lot of hyphae, is that what they did? Yeah.
Always difficult to treat those as well.
Yeah, but luckily I managed to completely clear it. Lady went to the GP, came back to me literally a week later after the appointment, and the whole thing was just again, just completely full again. This is within a week.
It's so difficult. It takes some time over here in the UK to get GP appointments at the moment. It is harder to get GP appointments just because they're so swamped. And then, you know, we see these patients. We're not allowed to prescribe, so we have to contact the GP for a prescription. By the time the patient gets, or the GP gets the letter, we email it straight away. But by the time they've sort of read it, acted on it, got the patient in, you know, that's all. Everything you've cleaned out, it's all come back. That's why we tend to book patients who had infections. We'll book them in for a follow-up, and we will say, look, you know, do your antifungals, antibiotics, whichever it is, you know, for a week. Come back and see us, and we'll treat you. We'll go free follow-up after that, then, just to make sure they get nice and clear.
Especially if it's a wet type of infection.
Those kind of candida, mushy infections are always more difficult to do.
Or the video that we put up a couple of days ago, last week.
Before and after infection on it. Yes, that's a good one to watch. If you haven't watched that one, guys, it's I only went on last week, so go and check that one out. I've introduced some oil in here now, just because I'm into that deeper section, and it's just not going anywhere. This skin is just so hard.
Yeah, it's like it wants to come. You can see it's almost free, but it's pretty tight in there, to be fair.
If it wasn't this deep, I think I would have gone in with a hook right in the middle.
Oh, I see.
Just try to hook the end and bring the end down, but it's, you know, it's so deep. It's going to be sensitive, like really, really sensitive. So I'm trying to bunch into the suction in a minute. I'm trying to gather as much of this debris into the suction end as I can, and then try and aim for that white skin underneath. It sounds counterintuitive, but that skin is much softer, and you tend to bed the suction tube into it a little bit better and more effectively to that area. So I'm trying desperately to get to that bit of skin. I am wiggling like Billy here to get this out. It is just...
So it looked like it was about to roll from underneath and kind of...
It did, didn't it?
Oh, It's that top right corner, isn't it?
It is.
I think that's
if
where
I
it's...
can detach that bit of white skin to the left, I'm thinking, because I can see that's anchoring the left side. I might just be able to peel it or just pull this left side across. Oh, there you go, hooks in. Let's see if we can get behind that section there. I know. You can see that real difficult consistency to work with. Even the hook, I'm afraid to push too hard with the hook.
Yeah, because your canal.
Because the canal is literally just underneath that section. But when we go back in, you might be able to spot it, but there's this whole white dead skin layer that goes all the way back. Look at that. And that's why this front end is just not releasing.
Oh, tricky one.
Not easy, this one at all. But now I created a gap at the top. I'm hoping I'll be able to lift into that gap. But look at it, I'll tell you that is just so thick.
That needs to be drowned full of oil or something.
Yeah.
I would just get plenty in there.
See,
I know you said about the... Yeah.
It does. It needs, because this is the always difficult with this particular type of skin removal, because you always end up these layers that build up from the eardrum outwards, and you know, to try and almost force those layers apart to get this plug away. So what you're seeing here is the natural sort of dehydration process of the skin. So the bit at the back, which is that whiter, softer material, that's the skin in its kind of freshest form. Yeah. And then this, what you got at the front then, is that sort of dehydrated, keratinous kind of skin. Yeah. Then right at the end, the sort of more older, aged skin that's come away. It's almost like the surface of that one.
It did come forward a little bit though when you pulled out with the forceps.
It did. It did.
Oh, you're gonna go again now with this little bit.
Yeah, I think I'm just going to try and bunch again.
I thought you were going to go forceps again then.
No, I think what I'm trying to do is get everything to the middle. Yeah. Just really get it away from the canal walls as much as I can here. It's just so it wants to naturally return back to its original position, which always makes it harder. Yeah. I might end up going forceps, I don't know with that bit. Depends on what happens with this next part of the video here, really. Because I can see there's this sort of line there. Okay, yeah.
Oh, there it is. That's what you wanted.
Yeah.
Oh, the relief. The relief.
Oh, look at that. Look at that. Look at the size of that plug. I mean, it didn't look like there was that much left to get out of there. But
it's like a little rocket with flames going back there.
I'm just trying, it's right above the tip of the hammer bone there. I'm trying to see if I can get this piece away. I know, it's really difficult.
Area,
yeah, it's a hard one to get it out of. And looking at how thick that was, that pars flaccida is the more flexible part of the eardrum. Oh, the sneaky little bit that came away there. There you go, this is the other side. So this is mostly just wax. This isn't skin, so it should technically come away a little bit easier. So this is still the rye hook from the last side as well. So we're just going to pull this one through. Look at those hairs though.
Yeah. Oh.
How dense is that in there?
We've had worse though, haven't we? We've had worse, to be fair. Ones that are not even worth putting up on YouTube.
You just can't get them out. The hairs are so difficult to look at that. It's like a hedgehog. The hairs are so difficult to remove because they just don't respond well to suction. The only thing you can sometimes get them out with is crocodile forceps. But look at that now. That's looking a hell of a lot better in there.
Yeah.
And there we go. So we've got Inch and 3/4 I've got to put on there.
Yeah, 5 centimeters on that one.
I know, it's a beastie. So look at that big chunk right in the middle.
Yeah.
Well, guys, thank you very much for watching that video again today. If you do enjoy the videos, don't forget you can always like, heart, share, follow, and subscribe for us. That'd be fantastic. If you thoroughly enjoy the videos, you can also consider becoming members of the channel. We post new extra videos on Tuesday and Thursday for members only, so make sure you don't check that out. But in the meantime, guys, as always, take care of yourselves.
Take care of your ears.
And take care of one another, and myself and the lovely Mr. Taylor Green. We'll see you again real soon. Bye, everybody.
Bye-bye.